Hi everyone, I'm Dr. Dina Muhib. Today I'm going to introduce a session about smoking cessation counseling. It's for NAC OSCE stations. As you all know, it's always advisable when you are taking social history from the patients. You have to ask him about smoking, and if he is a smoker, you have to advise him how it's important to quit smoking. And also, and besides of that, also smoking can affect our central nervous system. It can cause anxiety, irritability, depression. Also in eyes can cause glaucoma, cataracts, and age-related macular degeneration. And of course, it has a great bad effect on respiratory system. It makes lung more susceptible to infections, causing lung cancer and some chronic lung conditions like emphysema, chronic bronchitis, COPD, and other onset asthma. So now in the NAC OSCE, of course, you will find the paper in front of the room stating that, for example, Mr. Mark is one of your regular patients who comes today seeking for a help to quit smoking. Do a smoking cessation counseling. And why here I said one of your regular patients. You have to know it. Your greeting to the patients, it will be different if he is your regular patients or is a new patients. For example, if he is one of your regular patients, so you will just say, "Hi, good to see you again." You don't have to say your name because he's one of your regular patients, so you know him and he knows you well. Um, so after knocking the door, of course, greeting the patients and asking how can I help you. When he states that he's coming today for seeking for help to quit smoking. Smoking quitting has what we call 5 A's approach. First A is for ask. It means that you have to ask the patients about detailed history of his smoking. For example, how long has he been smoking? How much, like how many cigarettes a day, a week? How this affect his mood? Does he smoke occasionally, like with friends, or also by himself? And how this impact his life, his relationship with his partner? All of these detailed history has to be taken. Second A for advice. We have to advise the patient and tell him all the risks of smoking, as we mentioned before, how it affects his body badly, and assure him that he took the right decision to quit smoking. Third A is for assess. It means that you have to make sure that patients understand all the consequences of smoking on his health, and also assess his level of motivation. Um, and number four for assist. And assist also goes with the STAR approach. S is for set. We have to make the patient set a quit date when he will quit smoke, and it's better to make it immediately, like it would be better, like to be within 2 to 4 weeks. This would be great. And T for tell, like ask him to tell family and friends, asking for support, because when he finds support around him, this would encourage him and make him more motivation to quit smoking. And anticipated challenges that a patient will face. You have to tell him exactly what challenges he might face. Like the first period will be hard. He will always think about smoking. His mood might be not good. All of these challenges he has to be ready to face. And R for remove. Ask the patients to remove all tobacco products, as well as recommending counseling programs to help him through this process. And here we have to tell the patient that there is pharmacological therapy and non-pharmacological one. For pharmacological therapy, offer the patients that he can take nicotine replacement therapy, pepropine, vernis clean, and of course this after taking the history from the patient, medical history, to see if he has any contraindications for any of these drugs. There is also non-pharmacological therapy. It's by joining groups for behavioral counseling programs, or group counseling, to join a group of people who are quitting smoking at the same time. And of course telephone counseling also would be good. Here the last A for the 5 A's approach is arrange. You have to arrange a follow-up appointment within 1 to 2 weeks with him, because the first period of quitting smoking would be hard. So and actually the highest rates of relapse are within the first 3 months of cessation. So it's good to see the patient within 1 to 2 weeks, and after that maybe after a month or 3 months, and tell him that you will be always here for support through this process. Okay, at the end, I want to thank you for listening, and I hope you find this session helpful.